morning, dear viewers. You are most welcome to the Daktari show on Westnile Tv, which airs every Thursday. You can get us on Star Times 477 and Zuku satellite dish. You can get us on 0073. Once again, it's your host, Sunday Junior Tom, on this Daktari show. Last week, we had a topic of discussion which was about HIV. And today we shall talk about our topic of discussion will be about family planning methods. And we appreciate our viewers out there who follow our program from the start till the end. And we think it has been of benefit to you and helped you save costs, as it has given you knowledge on how to prevent and control diseases. As a white man says that prevention is better than cure. So our topic of discussion today is about family planning methods, and a recent survey done by the Uganda Demographic Health Survey showed that Uganda has a consumption or the use of family planning methods as it was 30% less than being the minimum country using these contraceptive methods in the whole of East Africa. And this was attributed from a reason that we have poor access to family planning methods, and like their location where to get these services, there are minimal places to get them. With me here, I have a guest. She's an expert in reproductive health, and she's going to share with us today various issues and information on the family planning methods, how to use them, how to use the right method for you as an individual with your spouse to control your births in your family. And it is going to be an educative session. I hope you'll be with us from the start till the end. With me is an expert in reproductive health. You're most welcome, Madam.
Thank you so much, Sunday.
Yes.
Yeah.
Maybe you can introduce yourself to our viewers there who may wish to know who is our guest today.
Okay. My name is Monica Andrew Erima. I'm a lecturer in Muni University, Faculty of Health Sciences, Department of Nursing and Midwifery. And my specialty is midwifery and women's health. Good morning, viewers.
All right, thank you very much, Madam, for the introduction, and hope our viewers there have got to know you. She's a lecturer from Muni University, and she's an expert in these reproductive health issues, and she's going to give us more information and details on how we can choose appropriate methods to use in our families. So I come back to you, Madam. What is family planning in simple terms? Family planning, counseling and services in simple terms to our viewers outside there.
Thank you. Family planning, counseling and services is a process of helping couples, a man and a woman, to select the best option of family planning method they would need to check birth rate or to space their children. And it's very, very important for a couple to come together to select these methods. Before selection, ample information is given to them so that they willingly choose what can work for them. Thank you.
All right, Madam. So our viewers outside there, you have got to know that it's all about getting information, and which will guide you on how you can manage your family. So as we move to our next segment, Madam, you have defined for our viewers there what family planning, counseling and services are. Maybe what are the benefits to someone who is our viewer outside there, because we are talking of it, they may want to know what are the benefits or the importances of family planning to them.
First and foremost, family planning is very, very important to the couple themselves, beginning with the woman. It will make the woman at least to regain back the reproductive health before going to conceive again. Then also it will give time to this woman to make sure she looks after the whole family. You know, women are known for looking after the whole family and the little ones that she already has. And other than that, even for the man will not be on pressure to look after a very, very large family, because they are able to space their children, and in terms of school fees, it will not be so much burdensome to this man. And people who manage their families well, the family size well, are always a happy family, and that will even reduce misunderstandings between the couples. And then family planning is also very, very important to the nation, because if the nation is able to have people that can be managed in the family unit, crime rates are going to reduce, and the budget that the nation allocates to look after each individual in a country is also going to be appropriate if the number of the people that are supposed to access these services is being regularized. And this can only be done through family planning and very many other benefits. Thank you.
Okay, madam, thank you for that detailed information on how important family planning is, that it helps us have a manageable family such that we can have minimal costs, like also you brought in the issue of the government budget. Thank you very much. Then we move on the types, like services. When someone hears of family planning methods, or like just general family planning, viewers outside there just take it to be it's all about contraception. Is it contraception the only service under family planning, or we have other services under the family planning services?
Okay, thank you so much. In a family planning clinic, there are several services that are being offered other than giving out the contraceptive methods, and one of them is screening for sexual reproductive health issues like STIs, that is sexually transmitted infections such as syphilis, gonorrhea. These can be screened, and in case they are found, they will be treated. And other than that, they can also screen for HIV and AIDS, which is only known when you're able to take the test. And then other than that, they can also do breast examinations in that process of trying to examine physically the woman, and in the process, when they get someone is having a lump in the breast, they will recommend for further evaluation, and in case of breast cancer, when detected early, it can really be cured. Other than those services, they also elicit gender-based violence. You know, when they are counseling, a lot of information is being shared between the health worker and the client, and in that process, they can rule out gender-based violence and the couple can be helped. So there are very many services that are offered in the family planning clinic apart from the contraceptive methods.
Okay, thank you very much, madam, for that awareness you have created to our viewers, because also to me as an individual, I just knew family planning services, it's all about contraception, but you have told us other services under family planning, like the screening of STIs, the breast cancer examinations. Thank you very much, madam. Then when also we talk about some beliefs and the misconceptions on family planning, some people believe when they use these family planning methods, they will become barren. Like in their lifetime, they will not be able to give birth again to children, like that is the end. Then also other people believe when they use these STIs, it can protect them from, they use these family planning methods, it can protect them from getting STIs. How true are those beliefs in the society, madam?
Thank you so much. There are beliefs and misconceptions that people hold on these family planning methods, which I want to say are not true. Family planning cannot make you become barren. What happens? You already have those hormones in your body. They are just putting a low dose to increase it a bit so that the dose that you have in your body is not favorable for pregnancy to happen. So there is no way that you can become barren. Should you fail to conceive, it's good to do some evaluations to find out the cause of the barrenness. And then there are so many other myths and misconceptions about family planning, like he has said that when you use family planning, you'll not be able to get STIs or HIV, which is not true. When you sexually meet someone who has HIV and you are on a family planning method, like maybe, for example, the pills or the no plant, you will still get the HIV, unless if you add another method, which is the condom, which prevents pregnancy at the same time, HIV, stroke AIDS and STIs. That is when you will be safe. And then some people also in the community claim that some of these methods can disappear in your blood. Like there is one that is put under the skin, under the arm. That does not happen because it's not put in the blood vessel. It's just put underneath the skin where there is no blood vessel found. And several other myths and misconceptions that are not true. It's important for us to practice family planning so that we have a size of a family that we can manage. Thank you.
Okay, thank you very much, Madam, for the correction to our viewers who thought that these beliefs they had, the misconceptions they had on family planning. Thank you for educating them and getting to know that they are not true and how they can adjust to get and use these family planning methods. So, Madam, we zero now down. You told us of the services under family planning methods. You told us about the STI screening. So today let's zero down to contraception. What is contraception in simple terms for our viewers to understand it?
Thank you so much. Contraception are the various methods of family planning that couples use to space their children and check birth rate.
All right, Madam, thank you very much for the view on contraception. So maybe what are the various types or methods used in contraception? Because many people here, me as an individual here of condoms, what are the various types of contraception used such that someone can have a manageable family?
Okay, thank you so much. I think I'm going to classify them. They are hormonal contraceptives. These are contraceptives that have the hormones estrogen or progesterone in them. They can be combined or they can be single. It can be progesterone only, or it can be a combination of progesterone and estrogen. And those ones are manufactured. They are artificial. Then we have barrier methods of contraception. And then we also have natural methods of contraception. And now when you come to the family planning method, to the family planning clinic, the midwife will take you through all the ranges of contraceptive methods, and then after getting ample information on them, you will make an informed choice of the method that you want to use, and then it will be administered to you. Then the hormonal methods include the following. We have COCs, which are called combined oral contraceptives. These ones have both estrogen and progesterone. And they are pills, they are tablets. You're supposed to take them every day. And you make sure you do not forget. Because if you don't take them every day at the same time, you are bound to be pregnant. And then you will think that this method does not work. So it depends on how committed you are and how you can remember to take a pill every day. Then other than the COC, we also have POP, which is called progesterone only pill. In these ones, you'll only get the hormone progesterone, and they have less efficacy compared to the estrogen combination. And it's very, very important to know when to take these pills. For COCs, they are supposed to be taken after 6 weeks of delivery, because estrogen interferes with breastfeeding. It can be found in breast milk, which will affect the baby. So it's important for the baby's liver to grow a bit, and then you'll be able to take the COCs. What can be taken immediately is the POP. Once a pregnant mother has come for postnatal checkup at 6 weeks, we presume that by 6 weeks the reproductive health has gone back to its pregnancy state, and the mother and the spouse can be able to resume sex. So in that case, a family planning method has to be handy, because they can easily conceive again. So in that regard, you'll give progesterone only pill, which does not interfere with breastfeeding. Then after 6 months, the woman can be switched onto the COC, the combined oral contraceptives. So that is what is there with the pills. Then other than the COCs and POPs, among the hormonal methods, we have no plants. No plants are inserted under the skin, just under the arm, and that site is selected because it's not utilized so much. There is no serious reason of having it put there, and it's a bit hidden. And no plants can serve the mother as a contraceptive method for 3 years. Other than the no plants, we have two different types, the implanon and the Jadel. Implanon is for 3 years, and then Jadel is for 5 years. And in these no plants, the active ingredient is the progesterone, and they can be effective after 24 hours. That means once they have put it in the hospital or in the health facility, you let the couple know they delay sex up to 24 hours. If they can't delay, they should use a backup method, which is a condom. Then other than the no plant, we also have IUD, which is called intrauterine device, and they are of two types. There is that one which has the element copper, which stays for 10 to 12 years when inserted, And then there is that one which has a hormone which is called Mirena, and it only serves for 5 years. And all these methods come with their side effects, and the most common side effect with the IUD is excessive bleeding. Many times mothers tend to bleed a lot when the IUD that takes 10 to 12 years are inserted. But then not all the mothers are going to face this. In case someone faces that, they should be able to report back to the health facility and it will be handled. And then for the case of the IUD, which has progesterone only and which lasts for 5 years, actually it does not cause a lot of bleeding because of the effect of the hormone. And many times if someone is uncomfortable with the one that causes some heavy bleeding, they are switched to the hormonal type. But ultimately, before giving these hormonal contraceptives, a mother has to undergo medical eligibility criteria. That means there are some conditions that do not warrant these artificial contraceptive methods which have hormones. So as you report to the health facility, you will be examined thoroughly, and when you have some medical conditions that are barring you from receiving the method, you need to accept that the method is not good for you. Then you choose from other ranges of methods. That is hormonal methods. Then we have also these ones like Cyanopress, whereby someone gets an injection every 2 months, and Cyanopress has estrogen and progesterone. Then we also have the Depo-Provera, which is very, very commonly used when we moved around the West Nile region. It's Depo that most people are using. It contains progesterone only, and when we found out the reason why it's the most commonly used, they said that the spouses do not know that you have already gotten an injection. In a way, it's private. Then that made us to think that men maybe are not supporting their wives in accessing contraceptives. So it's very, very important for men to come to these clinics so that they get to understand the methods and how it will help them to control their family size. Then I mentioned barrier methods. There are a number of barrier methods, but the most common in these facilities is the condom. And condoms are divided into male condoms and female condoms, and how they are used will be explained very well to you. Importantly, it prevents pregnancy and at the same time sexually transmitted infections including HIV, stroke, AIDS. So when you come to the facility and opt for a barrier method, it can either be the male or female condom, much as we have others like the diaphragm, the ring, which are there, but the most commonly utilized are the condoms, and mostly the male condoms. But the female also do work if you can utilize them very, very well. And then another contraceptive method that we have are natural methods. The natural methods are methods that a couple has to monitor the reproductive system of the wife so that they can be able to prevent pregnancy. what do I mean by that? This couple should be able to know the menstrual cycle of the woman, and it calls for a lot of cooperation between the woman and the husband, because if there is no discipline, this method maybe could not work for a couple. So it's important to monitor the menstrual cycle and make sure when the when menstruation starts, that is bleeding, there is that monthly bleeding that every woman in reproductive age undergoes, and many times it starts like from 12 years, it can be even as early as 10 years up to 49 to 55 years. That is the time when a woman reaches menopause. So in between here, monthly, a woman or a girl will be shedding blood, and it's on that basis that pregnancy can occur. So the couple have to monitor this cycle, and the first day the woman sees the period is the first day of the cycle to be monitored, and then you count from that first day of seeing the period up to the 14th day. That is where we anticipate ovulation taking place, and by that time a lot of things happen. The cervical mucus will be very stretchy, it will be slippery and stretchy, and yet initially it's a bit thick, but at that time you will see it increasing, it becomes stretchy, and if you can pick it and stretch in between your fingers, you'll be able to see how stretchy and thin it is. And then there is high likelihood of a woman getting pregnant. So when you notice that, you avoid sexual intercourse during that moment. And this calls for a lot of cooperation between the woman and the husband. And if you can do it very well, it can make you check your birth rate, space your children for a very, very long time. And then if you can't do that, those with digital phones, nowadays smartphones are at the order of the day, you can download an app that is going to help you monitor your cycle. There are so many. There is this Chinese calendar, then there is this one which is called Meet You. Each time you go into your period, you feed it, because you need to enter it into that app, and then it will be able to tell you when your ovulation is, and then which days are safe for you to have sex, unprotected sex, and you do not conceive, and which days are likely that you can conceive. So you can have that app on your phone, and make sure you keep checking every day. It will tell you when you're getting the next period. So it's a very, very key thing for us to make sure we cooperate with our spouses, to make sure we check birth rate and we space our children. The normal spacing, the recommended World Health Organization spacing of children is at least 2 years. First, make your body to rest for 2 years, then you can get another child and get children that you can be able to manage. Thank you.
Thank you very much, Madam, for that detailed information you have given to our viewers. They have gotten to know the various types of methods where you broke them down to hormonal, you broke them down to the barrier methods and also the natural methods. Then maybe a viewer outside there may have a question. Where can they access these family planning methods? Then also apart from that, there are other people like our Muslim brothers and sisters, also the Catholics. They don't use these hormonal contraceptives. Which other way or which guidance can you give them, or an option or an alternative for them to use in order to control or manage their family, number of children in the family?
Thank you so much, moderator. Yeah, these family planning methods, actually family planning methods are a right of a woman. There is no woman who should not access family planning methods. And there are so many places, so many authentic places where these services are provided. The nearest government hospital in your vicinity is the ideal place where you can access these family planning services. It can be a regional referral hospital, it can be a faith-based hospital, it can be a health center 4, it can be a health center 3. So where a facility is located around you is where you should go for family planning services. Avoid going for family planning services on the counter, because these ones in the hospitals, in the health facilities, there is a way they are kept and there are standards that they meet to keep the active ingredients that are in these contraceptives that will make you be able to control pregnancy or check birth rate. But if you get these ones from the counter, sometimes it may disappoint. Yeah. And then the moderator still asked about our brothers who are Roman Catholics and the Muslims, and many times it's believed that their belief system does not allow these hormonal contraceptives. Yes, I cannot say that all are not utilizing. It will depend on an individual. If you really feel you can handle the artificial contraceptive methods and you are in that belief, no one is going to stop you from accessing. But in case you feel you cannot utilize the hormonal contraceptive methods according to your belief, your religious belief, you can opt for a barrier method, so long as you use it so well, especially the condom. You need to make sure you put it on very well, and you use once. There is no repeating during sexual intercourse. Once the man has ejaculated, that one you throw it aside. If you're going for another round, make sure you open a new one, and it should be put on very well so that it can protect you from pregnancy and also from getting STIs and HIV, stroke, AIDS. Then another method that can be suitable for people with religious, let me call them barriers, because those beliefs, they act as barriers to accessing certain contraceptive methods. In that regard, they can also go for natural methods like monitoring the cervical mucus that I explained before, and then monitoring also your cycle. After detecting that pregnancy is likely, you avoid, you abstain during those moments, and make sure you only have sex when you are 100% sure that pregnancy is not likely. And I still stress it calls for a lot of support from the spouse. So men need to be involved in family planning so that it can succeed. Thank you.
Okay, madam. Thank you very much for that detailed information and overview you have given to our viewers out there, especially our Muslim brothers and the Catholic sisters, about the various methods they can use and alternatively other than the hormonal methods in order to be able to manage or have a manageable number of children in their families. Then I come back to you, madam. Which basis or can you give someone in case someone has an intention to choose a family planning method? It may be hormonal, it may be natural, it may be a barrier method. Which guidance or which factors can someone based on to choose a specific type of family planning or contraception method, or which guidance can you give to someone outside there in order to choose a contraception method?
Okay, thank you so much. Once a couple or once a woman has come to the family planning clinic, we take them through, we first tell them what activities take place there other than family planning, because you'll find that maybe they want to also know their HIV status. That one will be done. And another important thing is cervical cancer screening. Some could also hear about that. They want to access the services that will be done. And a thorough history is taken from this mother. And this history ranges from medical, surgical, like has she ever been hospitalized because of maybe high blood pressure, diabetes mellitus. All this is elicited by the midwife. After taking thorough history, if you discover that someone has had hypertension, then you cannot give a contraceptive that has estrogen, because estrogen is going to increase the blood pressure, yes, which is not healthy for this mother. So you'll make sure anything that has estrogen is not administered to this mother. And then in case the mother is maybe having HIV and AIDS, when you're taking history, and you will know that the medications that are taken for HIV, for controlling the CD4 count, are not very good. They do not work well with family planning methods. They will reduce the efficacy of the family planning method, and that will expose this mother to pregnancy. So there you'll make sure you don't give progesterone only contraceptives to this mother. So after doing history taking, you do physical examination in case you missed out to elicit some complications that do not warrant certain methods. When you do physical examination, you'll be able to get them out, and at the end of the day, you will be able to provide the best method for this mother, even if she had selected something which will not help her. And she'll be able to understand that because of my condition ABCD, maybe hypertension, because of taking antiretroviral drugs, I'm not eligible to taking this. Then together with the mother, you'll be able to select the method that is appropriate to her. Thank you.
Okay, madam. Thank you very much for the information you have given to our dear viewers there on how to choose an appropriate contraceptive method to use. Then also, madam, of recent we saw in the Parliament of Uganda where the Minister of Health tabled a suggestion, because we have this reproductive age being from 15 years of age to 49 years. But to access these contraception methods, it is only for adult age, meaning it is 18 and above. 18 and above. Then the Ministry of Health was suggesting that they reduce this age from 18 years to 15 years, such that also this age group or the children who are between 15 and 18 also can be able to access these contraceptive methods in order to prevent the unwanted pregnancies. So when I come back to you, what is your view on that take which was tabled to the Parliament by the Ministry of Health to bring in these contraceptive methods for the children aged 15 and 18 or lower in this age, because most of the parliamentary members led by the Deputy Speaker, they were against this view. Maybe what is your take on this view, Madam, of lowering the contraceptive age access from 18 to 15 years of age?
Thank you so much. Yeah, this has been a public outcry. First of all, for a parent, it really feels so bad to hear that a child is accessing family planning methods, and many things will run in the mind of this parent. They will think maybe this child is moving up and down with men, which is the major thing that is disturbing us parents. Yeah, the consent age in Uganda for an adult is 18 years, and that is when the contraceptives were intended to be started. But now, due to exposure, children have been exposed so early to sex due to the technology and very many other issues. And I think I would still stand the 15-year-old is still too young. The reproductive system is not yet well developed. In case they are to conceive, they are not even going to be able to manage the stress of pregnancy. And for this particular 15-year-old, if they are exposed to sex already, a contraceptive method is better for them, so that they do not go through those difficulties in giving birth. But we also need to stress that we need to give sexual education to young girls in secondary school, in primary and secondary schools, so that they can abstain from sex. The best method for anyone below 18 years is abstinence, and that should be emphasized in communities, in those schools, in churches, so that the girls get to know that their body is still young. At the right time, they will be able to enjoy sex. But apparently, they should be on abstinence. But in a particular case where a child is already exposed, my take is they can take up family planning methods. And when they access these family planning methods, the midwives right there in the facilities should not be judgmental. They should be able to talk to this girl and help them out, instead of the girl skillfully going for emergency contraceptive methods every now and then. They would rather be on family planning method. Thank you.
Okay, Madam. Thank you very much for the detailed information you have given to our viewers. Also, you have given your view, and also you said you stand that it's not advisable as a parent to put someone below 18 on contraceptive methods. Again, like maybe when we come to the correct use of these contraceptive methods, maybe before we go to that, I heard you talk of an emergency pill. What is an emergency pill?
An emergency pill can be called a morning after pill, and this is a combination of progesterone and estrogen in high doses given to a person who has had unprotected sex within 72 hours that they are intending not to carry a pregnancy. So they go for the morning after pill, which is called emergency contraceptive. Thank you.
Okay, madam. Thank you very much for the education and information about the emergency pill, which you called also a morning pill. Maybe when we come to the contraception use, you told us we have the hormonal, where you talked about the pills. We had the barrier methods, where we talked of the condoms. We had of the natural methods, where we talked of the monitoring the woman's menstrual cycle. Maybe now when we break down briefly, when we come again to do how you broke it down, how can someone correctly use the hormonal methods of the pills? Just briefly. Then after that, you also tell us briefly how someone can correctly use the barrier methods, and also lastly how someone can use correctly the natural methods, so like monitoring the woman's menstrual cycle.
Okay, concerning pills, just as I stated before, one has to use them consistently. You have to remember to take a pill every day at the same time. Why at the same time? Is because if you alter the time, we will not be able to get the hormonal levels that we are targeting to prevent pregnancy. So if you can religiously remember to take your pill every day, then you're eligible to using the pills. And these pills, in any case, for example, for the combined oral contraceptive pills, if you've forgotten to take like one day, the moment you remember, you should take immediately. Or if you've forgotten like to take 2 pills, the moment you remember, you take immediately. But what action do you need to do? That means your hormonal levels are not now at the level that can prevent pregnancy, so add on a barrier method. A barrier method of choice is the condom. The moment you know you've not taken your pill very well, use a condom for the next 7 days. As you're taking your pill, as you continue taking the pack every day at the same time. So after 7 days, by then we will know that your hormonal levels have become steady, and then you can just continue taking the pill. But in any case, you have missed, like maybe if you've gone for a safari and you've missed like 5 to 7 pills, just make sure you discard the remaining pills and you get a new pack, begin taking, but also add on a barrier method, which is a condom for 7 days. Then after that, you will be safe to have unprotected sex.
Okay, thank you very much, madam. Then maybe if I come back to you as we're almost wrapping up the show, what are some of the side effects do these contraception methods have? Are there some bad effects or some effects which someone should be worried of as they're using these contraception methods?
Yeah, now with the pills, some in the very first months, there can be spotting. You will find out that you won't get your periods exactly at the same time because the hormones have not yet balanced well. In between, you can get some spotting, bleeding, but as the body gets used to it, it's going to stabilize. That is the pill. And then if you get excessive headache while taking the pill, it's not a very good sign. There you have to go to the health facility. They will examine you, and maybe probably your pressure has gone up, and they can stop the method and counsel you to take another method. That is the combined oral contraceptive pills. Then with the Depo-Provera, the most common side effect is not seeing your periods. Once you've taken like 2-3 shots, your periods may not be able to come, but that does not mean that blood is accumulating anywhere. Blood is not accumulating anywhere. Actually, your uterus has been disorganized and it's not really bringing that blood that is supposed to come monthly, because it thins the it normally thins the uterine lining, which is the endometrium, that sheds every month. So don't get worried that blood is accumulating anywhere.
Okay.
And maybe
I'm sorry to cut you short. Let's first get for a short commercial break, and then we shall be back briefly. Maybe what our viewers should not miss in the next segment are more of these side effects of the contraception use. Thank you very much to our viewers who have been with us from the start, and we are coming to almost the end of the show. Thank you very much, our dear viewers.
Starts 15th September. Go for it!
What a finish from Fukume!
The Ugandan flair, Brazilian samba, Portuguese magic, the night football craze. More TV games live on Senyuka Prime and Fufa TV only on Star Times. The Star Times UPL. Our league, go for it. Starts 15th September. Go for it!
What a finish from Fukume!
The Ugandan flair, Brazilian samba, Portuguese magic, the night football craze. More TV games live on Senyuka Prime and Fufa TV only on Star Times. The Star Times UPL. Our league, go for it.
Westnile TV, lighting up the region. Westnile TV, lighting up the region.
welcome back our dear viewers from that short commercial break we had, and this is still the Daktari show on Westnile TV. Start times you get us on 477 and on Zuku satellite you get us on 0073. Our topic of discussion today was about family planning methods, where we again our guest defined it for us what family planning is, where she talked of all about having a manageable family. Then we went on the importances of family planning. She also gave us brief detailed information there. We zeroed down. She told us family planning is not only contraception as many people perceive it in the society, and she told us the other services we get under family planning, counseling and services, where she talked of the screening for sexually transmitted diseases and also the breast cancer examinations. Then we went down to the contraception methods, where she broke them down for us into the hormonal methods, where she talked about the pill use, the COC and POP. Then she again went to the burial methods like a condom use, and also the natural methods where she talked of monitoring their menstrual cycle. Then she also told us how to correctly use these methods, where she told us for the hormonal it requires discipline, whereby you have to take it daily. Maybe if you forget, you can maybe talk to your spouse to always remind you. Then the burial methods also, she told us to correctly use the condom, and it is one use time only, whereby you cannot use it in case you want to have another round. Also we went on the natural methods, where she told us it requires discipline also, maybe in case you want to screen or like to determine whether your woman is at the reproductive season, where she talked of the cervical thickness, the mucus from the cervix, and also she told us details about that. Then we were still on the discussion on the side effects these contraceptive methods have on an individual using them. We can continue on that, madam.
Okay.
Yes.
Yeah. And talked about the COCs being severe headache, which is the most side effect that should make a woman report to the hospital. And maybe if the woman is also having blurred vision means seeing two, like there is one thing but you're seeing two in one. Like if you're looking at me, I'll be two. So that is called blurred vision in medical term. If that happens, the woman should immediately go to the hospital so that they can reassess, and then give the appropriate method. And then also I talked about the Depo-Provera, of which the most common side effect is the absence of menstrual periods, and this bothers women a lot. And I still emphasize that blood is not accumulating anywhere, but instead the uterine lining that has been shed, bringing out the blood, is thinned. It's completely thinned because of the hormone, and it is an advantage. Yeah, so that should not bother women so much. If they see that, that should not be what will take them to the hospital. But in any case, someone is having a severe bleeding, when they are getting Depo-Provera, they should be able to come back to the hospital for evaluation, and they will be managed. Then for implants, the Noplant and Jadel, and the most common side effect is also absence of menses, and that should not bother so much. That is a minor side effect. And also spotting in the first 3 months, which is also not really something that can bother you so much. You'll just see some slight blood in your knicker, and that is not really so worrying. What should be worrying is when you get severe headache, and then you also get severe bleeding. You should be able to come to the hospital or to the health facility for reassessment, and then the appropriate treatment and method will be given to you. And then when we come to the IUD, the most frequent side effect is also that bleeding in between periods, and if it is really slight, that should not bother you unless when it becomes heavy. Any bleeding that is heavy where you're changing the pads as if you're in your periods should be able to bring you back. And also there is a lot of, many times if a partner is not so faithful, there are a lot of infections that can set in. So when someone has a severe lower abdominal pain with the IUD, they should also be able to report to the hospital or to the health facility. They will be reassessed and then treated. And remember, they cannot remove it before treating you. You'll be treated, and if it's to be removed, then it will be removed. If it's not to be removed, then you can continue with that. Yeah.
All right. Thank you very much, Madam, for the discussion on the side effects these people who are using contraceptive methods can have, and you told us they are not that worrying, except in case maybe someone has a severe headache. Maybe also, Madam, to ask you, on the burial methods we talked of the condom use. How true is it? Some men say that when they are using these condoms they irritate them. Is it true, or these men be out there lying to their spouses?
Thank you so much. Yeah, there are some men who are allergic to rubber, and in that case, putting on condoms can irritate them. And these are very, very rare cases. And in any case, someone is allergic to rubber. There are also other types of condoms that are preferred for people who cannot tolerate latex, which is the rubber, and then such a type of condom can be prescribed to such specific group of people. Then when they use it, it will still serve the same purpose. Thank you.
All right, Madam. So I thought all along it was a lie, but you have told us it is true that also often some people are allergic to rubber, where you talked of the latex, this which is in condom. Then you said they can recommend an alternative for them. Then also maybe, Madam, as we are almost coming to the wrap up of our show, some people when they hear of family planning, is it all about managing having a sizable family, or managing the number of children you're going to have, or there could be also something else apart from just managing your family?
Yeah, thank you so much. Like we talked about the benefits of family planning, it is not only going to make you to space your children or to get the number of children that you need, but still it comes with those many benefits that I already talked about, especially concerning the woman's health. You're not supposed to subject yourself to these excessive hormones of pregnancy frequently. So by doing that, the woman will remain very fit. And sometimes you see women who are like 30 but they are looking 50 just because they frequently give birth. So their state of reproductive health is not good, which will also strain the whole body system, and then a 30-year-old looks like a 50-year-old. So it has a lot of health benefits to the woman.
Okay.
Yeah.
Thank you very much, Madam, for the importance that it's not only about having a sizable or manageable family where you have few children, but also it can enable the woman like have rest in giving birth, because if she gives birth frequently, it will lead like to affect her body, like the body will mature very fast, and the person with a 30-year-old may appear like someone who is 50-year-old. Thank you very much, Madam. Then to our viewers, we are very grateful who have been with us from the start, where we had our topic today of discussion, which was about family planning, and we zeroed down to contraception methods. And Madam here Madam Monica has given us the side effects about contraceptive use, about the headaches and the mild spotting like a woman you will find in Yonica. Then also we went on some beliefs where we talked of the irritation, some men who are irritated by these condoms. Then she told us there are alternative condoms they give which are not made from rubber. We are so grateful, madam. Then we are glad to our viewers there who have been with us from the start as we are coming to the end, as we are wrapping up our show. Thank you very much, our dear viewers. Also, we are grateful to you, Madam Monica, for giving in your time to come and educate our public about contraceptive use and family planning. Thank you very much, Madam, for your time.
Thank you too.
Okay.
Yeah, thank you so much, viewers.
Okay. Maybe some conclusion remarks you can give to our viewers and maybe some take-home points they can take or note down.
Okay. Thank you so much for giving me this opportunity to wind up with my viewers. And I really want to say that I'm so passionate about women's health. So I'm urging that men and women, husbands and wives should work together to make sure they have a very good state of health for the woman, being that the woman is the one who looks after everyone in a family. They have to be in a sound state of health. And what does that mean? Family planning comes handy. Make sure you support your women to access these family planning services so that they are able to get children that are really productive to the nation. And that will only be achieved when they have the number that they can be able to manage. So men, I urge you to come on board and support your women in accessing family planning services in the health facilities. Thank you.
Thank you very much, Madam. So, the keynote I've gotten from our conclusion remarks that it's men, our dear viewers, there are men that will also come on board. We support our women to get these family planning services and contraceptive methods like the barriers, hormonal and the natural methods. Thank you very much, our dear viewers who have been with us from the start. And as we have wrapped up our show, we have reached its climax. Thank you very much, our dear viewers. We'll catch up again next Thursday, same time from 10 a.m. And maybe you can also tell a neighbor that there is an educative show called the Daktari TV show, always on Westnile TV, and you can get us on StarTimes 477 and Zouk Satellite 0073. Thank you very much, our dear viewers. We are also blessed to serve you. Have a nice morning and let whatever you do be fruitful. Thank you very much. Have a blessed day.